When we talk about routine management practices, we're referring to tagging, disbudding, castration and weaning. All these activities must adhere to animal welfare regulations. Calves must be tagged as part of the Bovine Animal Identification System and the BVD Eradication System. Calves can be tagged as soon as possible after birth or at least before 20 days of age. Well, it's most important to have the calf adequately restrained for tagging. Ensure that the taggers is properly aligned by checking its function, and when applying the tag, make sure that the tag goes into the middle third of the ear, avoiding any arteries or veins. Calves can be castrated in early life by using the Bordizzo or indeed rubber rings. It's best practice to castrate the calves before 6 months of age at least. Calves should be disbudded as soon as the horn bud appears. After 2 weeks of age, it's a requirement that calves receive a local anaesthetic or an analgesia for pain relief. So when disbudding a calf, restraint is most important and a dehorning purpose-built crate is preferably used. The hair is clipped round the horn with the scissors and a disbudding iron is used over the horn bud and rotated but 10 to 12 times in a semicircle. Once the procedure is complete, an antiseptic spray can be used on the area. Weaning is a crucial part of calf rearing and needs to be done correctly to avoid any setbacks in health and performance. Step weaning rather than abrupt weaning is more appropriate to reduce stress on the animal and to allow for a maintained performance. This involves a reduction in the number of feeds or the amount of milk fed during the day. Critically, it's appropriate to have a calf eating up to 1 kilogram of meal per day for 3 consecutive days, and then it's appropriate to wean completely. This is usually achieved by 8 weeks of age. Meeting important targets in terms of health and performance is crucial to successful calf rearing. In particular, growth rates of 0.7 to 0.8 kilos per day should give us a calf that's 80 kilo in weight at 8 weeks of age. Mortality rates of below 5% are achievable and should be attained. In addition, we should aim that less than 10% of the calves fall ill or need treatment. Good records of calf health, your input costs and regular weighing will provide you with a monitor of performance of the calves and indeed your enterprise.